Should you close the bathroom door when plunging a clogged toilet? Yes. Closing the door reduces odor spread and limits splash into shared spaces. Plunging correctly starts with selecting the right plunger and positioning your body. Use a flange plunger for toilets because its extended lip fits the bowl and forms a better seal than a cup plunger. Create a tight seal around the drain and keep the plunger submerged in enough water to cover the rubber head so you maintain suction. If the bowl is low, add water slowly until the head is covered. Start with slow, controlled pushes to expel trapped air, then follow with steady, stronger thrusts while maintaining the seal. Rapid or violent motions can break the seal and spray contaminated water. After several strokes, pull the plunger off with a quick straight motion to allow the blockage to move or to check if water drains. Repeat as needed up to about 1 minute total. If water is rising but not overflowing, pause to let the water level drop slightly before continuing to avoid spills. Once the clog clears, flush once to confirm normal flow, and then clean and disinfect the plunger and surrounding floor immediately. Common mistakes include using the wrong plunger type, which prevents a proper seal and wastes effort. Switch to a flange plunger and ensure the lip is extended into the drain. Another issue is plunging an empty bowl or with too little water, so suction fails. Add water until the rubber head is submerged to maintain pressure. A third concern is ignoring containment and ventilation, which spreads odors and may splash onto other bathroom surfaces. Keep the door closed, open a window or run an exhaust fan if available, and lay down towels around the base to catch drips while you work. At bighomeprojects.com, we help homeowners find local contractors and contractors find work with a community of homeowners and tradespeople sharing real experiences. We host a discussion community where members exchange tips about tasks like plunging toilets, containment best practices, and local service recommendations.